Thank you. Okay, ladies and gentlemen, let's make a start. Welcome everyone to April's meeting of the Local COVID Outbreak Engagement Board. Notice of recording advise all of you that this meeting is being recorded for live broadcast on the council's YouTube site, that anyone present in this meeting can record or take photos if you wish to do so. Could I just ask that anybody wishing to speak indicates by raising their electronic hand, and only speak, please, when you're called in to speak by myself. And could I ask that you switch off your microphone and video when you're not speaking, because that helps with people who might have limited bandwidth on their Wi-Fi. Item 3 is apologies, and I've received apologies from councillors Bridget Jones and Paulette Hamilton, along with apologies from Dr. Justin Varney, Dr. Mania Aslam, and Chief Superintendent Matt Shaya, with Superintendent David Twyford substituting, and there's also an apology from Richard Burden. Are there any other apologies anybody wishes to make? No? Okay, we'll note those apologies that I've just read out. Item 4 is declarations of interest. Does anybody wish to declare an interest in respect of anything on today's agenda? No? Okay. Minutes. Can we confirm that the minutes of our meeting held on 23rd of February are indeed an accurate record? Paul?
There is, when we come to matters arising, Chairman.
Okay, let's take that now then, Paul.
Okay, on page 4, page 5 actually, it's the 1, 2, 3, 4, 5th bullet point down, which says we still have insufficient data on death, but what we're seeing so far was that it was a similar high level of protection against death. When we've had the mortality figures before, and we've compared them to other core cities, I've always had a feeling that our figures are disproportionately high. And I would be grateful if Justin, when he's looking at these figures for the next meeting, could bring a report that would enable us to compare and contrast, because I think that it is important.
Yes, I do agree with you there. So I wonder, Errol, if you could make a note of that we can pass on to Justin, and if we could get agendaed onto our next meeting a report around the death statistics and how they compare with other comparable local authorities as well as core cities.
I mean, I just happened to recall I compared them to Leeds, which is our nearest comparator as far as population is concerned. All right, they've got a hinterland of a large rural area, as you will know, going up to Harrogate. And having said that, I got the impression that our mortality rates were about a third higher than Leeds, which concerns me.
Yeah, I think
it concerns all of us.
Be concerned about. So we will get something onto the agenda for next meeting.
Thank you.
Noted, leader. Okay.
Thank you very much. And that next meeting, of course, will be in June. Right. With that, one matter arising then noted, let's move on to item 6, which is the COVID-19 situation and vaccination update. And Toyin Amuzan is going to give us this report in the absence of Dr. Justin Varney. Toyin. Good afternoon.
Good afternoon. Sorry, I was not muted. Good afternoon, Leader. I will share my screen, and I must apologize that the slideshow function is not working. So if you don't mind, it'll have to be in the same old way. Right, now I'm looking for my PowerPoint. Sorry. Can you see my screen?
We can indeed.
Okay, thank you very much. Starting from the wrong place, am I? Right. This is the COVID-19 overview for this meeting. And we'll start with the overview, and we talk about briefly the policy updates that we have currently. Following the Living with COVID plan, there's no legal requirement for anyone to isolate if they test positive. The advice is that adults should stay at home, try and stay at home for 5 days, whereas students and those under 18 should try to stay at home for 3 days. The advice is also that if you happen to be in close contact with the person who's tested positive, or you may have stayed overnight in such a same household, you avoid that person, avoid any other high-risk person, avoid crowded places, and you're encouraged to wear face mask and continue to practice good hand hygiene. At present, as we all know, there's no more free symptomatic or asymptomatic testing for the general public. However, social care and healthcare staff, as well as older age groups and those who are deemed to be most vulnerable, are still being tested freely. The free testing is available for individuals with symptoms when they're patients in a hospital or when they're eligible for pharmaceutical treatments because they're deemed to be at higher risk of getting seriously ill from COVID. The government still retains the ability to ramp up testing in other settings whenever they deem it necessary. Vaccines and treatments continue to be the first line of defense right now, and care home residents and individuals over 75 and those who are also deemed to be most vulnerable are currently being offered a spring COVID-19 booster. People over 12 and over, people aged 12 and over who also had a severely weakened immune system at the time of their first 2 COVID doses are also eligible for either a third primary dose, a booster dose, or a spring dose. The figures that we have from the government website regarding vaccination, in Birmingham shows that for those all aged over 12 years, 68.8% of the Birmingham population over 12 have had their first dose, 62.5% their second dose, and 41% their booster dose. This compares not favorably to that in England, where over 92% have had their first dose, 86% have had their second dose, and 67% thereabouts have had their booster dose. Those are the English averages. UK HSA has given the following messages for us to help us live with COVID-19 as we're doing right now. First of all is get vaccinated, because this has been proven to reduce the risk of becoming seriously ill and also helps to protect others. They also advise that we wear face coverings in crowded and enclosed places. We're also advised to let fresh air in when we meet with other people indoors, particularly if those individuals happen to be at high risk from COVID-19. Hand washing is also important. And of course, the advice is to stay at home and get tested whenever if anyone has symptoms. This is the current situation and the 60-day trend of COVID-19 in Birmingham. The total deaths, variably all of these indices, total deaths, number of cases, hospital admissions, and the cases in over 60s appears to be on a decline. This is the same thing here. As with cases, we can see that there's a decline in the number of cases that we're having. And at the same time, we have also a decline in the number of testing, PCR tests that are being undertaken. Within Birmingham, the top 10 wards that have high case rates are these ones. I won't go through them, but they're there. And we go to the next area, which is vaccine effectiveness. And this is based on study done in all throughout England, and it's been proven that deaths appear to be lower in those who've received their booster or third doses of the vaccine compared to those who are unvaccinated. And the study shows that deaths which were driven by a reduction in the protection of previous vaccines during winter of 2021, these deaths seems to have increased, especially in the older age groups. However, it's been proven using the age standardized mortality rates that those who have been vaccinated tend to the number of deaths amongst the unvaccinated, beg your pardon, is much higher than those who have received their vaccines. And these are the rates amongst those who've received the first dose. And it's found that the third dose, those who received the third dose or booster doses seem to appear to have lower incidence of deaths. I'll talk about the variants of concern. And currently, even as we speak now, the Omicron variant remains the most dominant variant of COVID-19 in the UK. The recent trends, however, show that the rate of infection with this variant appears to have slowed down, appears to be slowing down. There's a variant known as Omicron XE, which was identified in England on 19th of January, but as of the 5th of April, about 1,125 cases have been recorded, but evidence is still being gathered to establish whether it's more transmissible or more severe, and the effectiveness that the existing vaccines will have with this, against this virus. Testing. If we see from here that testing has reduced. We've mentioned that there's various groups, only certain groups of people who are eligible for free tests. So testing, Pillar 2 testing has reduced, and so we can also see the positivity as well would reduce as well. We have here it's obvious again from this that the numbers of Pillar 1 testing being done and the rates of Pillar 2 testing are also gone down considerably, going down considerably. We go to case demographic, that is the people who are being affected by COVID currently. And what we have here is cases decreased in all age groups, which would be expected as testing is also reduced. And the largest decrease was found in the 0 to 19 age groups. The ONS model estimates have suggested, of course, and that there's underreporting in all age groups, and that is to be expected as testing, which detects these cases, has also reduced. We'll go to, oh, sorry, I'm moving up, am I? Sorry about that. If we go to the situations, the situations, right. Hospital, oh dear, sorry. These are hospital metrics data, the number of the hospitals within Birmingham, and we can see that the numbers of patients on ventilation is far reduced compared to what used to exist. And these are the hospital admissions within Birmingham. Deaths, data that we have on deaths, the most recent data that we have on deaths in Birmingham that occurred within 28 days of a positive COVID test is 68 deaths, which is equivalent to 5.9 deaths per 100,000 population. However, more accurately, data based on COVID-19 being mentioned on a death certificate is reported 50 deaths in Birmingham as at the end of, as for the month ending 8th of April. Of these deaths, 34 occurred in hospital, 8 in a care home, and 8 occurred at home. Oh dear, where am I now? Right. Contact tracing. The contact tracing team has their focus now is mainly on welfare of citizens. We do get testing data does come in from Pillar 1, LFDs and PCR, and the team spend time, since there's no requirement to isolate, they spend time contacting those they can who are willing to speak to them, asking if they need any help. Currently, the team is working to meet with UKHSA to present what a case tracing solution that they have that has been worked out, and it is anticipated that the contact tracing team might handle other non-COVID infectious diseases during the Commonwealth Games, and the team is working towards this. Unfortunately, the team itself has reduced in size due to individuals who are leaving the team. Over the past 7 days, the contact tracing team handled 2,156 cases with a completion rate of 36%. The update for schools. This the schools, the attendance for Birmingham of students in Birmingham is 88% as at Thursday 7th of April, compared to national figure of 88.6. And the public health team, the COVID response team, still continues to offer regular updated guidance to support the schools, and the schools individually should have an outbreak management plan in place. And the local health protection team also advised schools on what they could do, additional measures they could take should they have an outbreak during at any time. Vulnerable pupils. We have officers from the children's and families who continue to work to support, ensure that support is in place for vulnerable pupils and students during the time. The ongoing support for schools and settings. The schools have access to these different links and can make use of them and contact the team when they need to. Communications and engagement. I believe Damilola will add to this, but just to move on, it's just to say that the communication and engagement is still ongoing. There's a lot of digital engagement that has gone on in the month of March, and there's quite a lot here. I believe Damilola herself might would come in and continue with this. There are lots of messages that have gone out to the community to give them enlightenment as to how they live with COVID, certain messages, and encouraging vaccination, as we have been trying to do all along. And these are some of the content that the team have been involved with. There's community and partnership engagement that's been ongoing, and the COVID Champions program is being refreshed in a variety of ways. There's also been engagement with the Greater Birmingham Chamber of Commerce, and I believe a lot of work is going on with them to enable them to work with us as a team and to work with their organizations as well. So I think I will leave it there. I don't know if there would be any questions.
Thank you very much, Ty. There's a huge amount of information that you've just given us there.
Yes.
So thank you very much for that. I will take any questions. I've got some questions myself, actually. So going back to the start of your presentation, you gave some figures for vaccination in Birmingham compared with the country as a whole. Compared with England in actual fact. And we're not. We're way behind the rates for England in terms of first, second, and indeed booster doses. I just wonder, is the underlying reason for this still a reluctance amongst some ethnic minority communities to come forward for vaccination?
Yes, it is. And I would say that it might even be because people now believe that COVID is a thing of the past because of what the government plans and the government statements. But the team is still working to try and engage members of the public. It doesn't appear to be getting easier, as I'm sure Damilola might see when she does her presentation, but that's just unfortunately the way it is. It is a reluctance. The NHS and the COVID comms and engagement team are working flat out, trying different measures to encourage members of Birmingham citizens to come forward.
And that does sort of lead me on to my second question, really, because it does seem to me that UKHSA, it's all well and good giving out these messages that were on your slide, but telling people to get vaccinated if they're not coming forward to get vaccinated is not much use. I do think that UKHSA might want to think a little more innovatively about what they're doing. And similarly, telling people to stay at home and get tested if you have symptoms is not much use if in actual fact what's happening in the real world is people are not getting tested because you now have to pay for the testing kits. And again, I do think UKHSA need to be rethinking their messaging, because it seems to me their messaging at the moment is falling on deaf ears. I don't know if we could feed that back to UKHSA at all. And then just following on from that, deaths and this increase in the risk of death amongst older age groups as the vaccines begin to wane, the longer it is that you've had since your booster vaccine. It's certainly good news that those aged 75 and over and the most vulnerable are to be offered a further booster in the spring, so imminently, presumably. But I just wonder, looking a little further forward, when we reach the autumn of this year and start going into the winter, is there at the moment any intention to give a further booster dose to, I don't know, the over 50s, if that would be the appropriate age group where deaths increase the longer it is that you've received your booster dose? Are there any plans along those lines at the moment?
I believe that Damilola has her hand up. I believe she wants to respond there. Okay.
Let me bring her in then. Damilola? You're muted, unfortunately.
All right. Good afternoon, everyone, and thank you, Tony, for your presentation. I just wanted to quickly answer some of those questions you raised. Reasons for vaccine hesitancy. We did conduct a survey in Birmingham to understand why people were not interested in taking up the vaccines, and 4 things stood out. They do not trust the system. They have concerns about side effects of the vaccines. They want something convenient, especially for our local businesses. They want us to bring those vaccines to them. And another thing is poor risk perception. People do not understand that COVID poses a great risk to them. They do not understand how it affects their immunity, how it affects their kidneys and all that. And in public health, there's something we always say, because you did mention that NHS, is just dishing out information. In public health, there's a difference between giving information and persuading people to change their behaviors. And that's what comms and engagement is working on. And during my presentation, you appreciate that. About vaccination. So Toyin made a presentation. She's talked about our work with GBCC. We are working closely with them to get those vaccines to the local businesses. So we have identified some local businesses, and we have also worked with BSOL colleagues on how we can arrange vaccine vans to go deliver those vaccines. And we're also planning towards an hyperlocal vaccination event We've identified wards with very low vaccine uptake, and we'll be taking those vaccines to them. But of course, before then, we'll be doing a lot of engagement, persuading people, giving them information. So when I make my presentation, I'll shed more light on that. Thank you.
Thank you, Damilola. I think what you've just said underlines what I was saying a little earlier, that UKHSA simply telling people to get vaccinated if they're not getting vaccinated is never going to work. It is this persuasion and giving people more information about the risks they are running by not getting vaccinated. And I do think UKHSA really need to think again about what they're doing and just consider that the messaging they're putting out is, in my view, just not effective. Anyway, I'll see what you say in your presentation, Damilola. Are there any other questions that anybody wishes to ask? Oh, did you cover that point about are there going to be a further booster for those older people when we get to the autumn?
I believe that there will be further boosters coming. Right. There's also been talk of possibly combining the flu vaccine with the COVID vaccine. So, but that's all still in the works now. We'll probably get more clarity on that as the year goes on.
Okay, and then finally, Toyin, just this this further variant that has emerged. I think you said on the 19th of January.
Yes, that's right.
Is there an indication of when there'll be enough data for experts in this field to conclude whether this variant is indeed more lethal than the current prevalent variant?
It's still part, how do you call it? It's a variant of a variant, if you put it that way, in that it's still Omicron, and but since it was first seen in January, I think if I'm correct, I think it's about 1,125 cases have been found. So work is still ongoing to see whether it might be more transmissible, more dangerous, let's put it that way, than the previous variant. But the way things are now, and the fact that the number of cases, the trend in cases is a decline, we can't say for sure whether it's more lethal or whether it's probably just as lethal as the previous ones. But work is still ongoing to find out whether it's more transmissible, whether it will escape, has vaccine escape, which it might be more than previous than its parent variant.
Okay. Well, as I've said before, these meetings now are every other month, and if a variant does emerge that's going to prove to be problematic, we will, of course, convene a meeting of this board in order that we can discuss that particular situation. If there's no further questions, then I'm going to thank you, Toyin, for your report, and we'll note that, and we'll move on.
Thank you.
Item 7, living with COVID strategy. This item is being deferred to June. So moving on then to item 8, communications and engagement board plan. Damilola. Damilola?
Yes, I'm here. I'm trying to share my slide. Thank you. Right. Sorry, please bear with me.
Sure. Yes. Oh, we can see your calendar at the moment.
Okay. I'll just have my video switched off, please, if that's okay.
Sure.
All right, good afternoon, everyone, and a pleasure to be here. Name is Damilola Akishilure, and I'm a clinical doctor and public health consultant leading on communication and engagement. Today, I'll be giving a quick update on the forward plan for comms and engagement in line with the Living with COVID strategy.
Damilola,
yes.
all we can see at the moment is your calendar.
Really?
Yeah, you've shared your calendar with us.
Oh, wow. I'm so sorry.
That's all right. That's better.
Thank you. All right, so before I begin, I'd like to talk about what we've delivered so far. The comms and engagement team was set up to support the local control of COVID-19 outbreaks, communicating and engaging with various community groups to promote awareness and understanding of COVID-19, with risk reduction measures to minimize the transmission of the virus. We have continued to work hard to promote messages that are accessible and adaptable to different audiences through various communication channels. And one major lesson for us from the pandemic is the importance of building strong relationships with local citizens, because without this, it's difficult to achieve success, addressing the needs of a population. We worked closely with existing faith groups. We commissioned 20 community providers and launched over 800 champions to deliver accurate health information and COVID guidance across Birmingham. Through regular fortnightly meetings, we created a forum where members could have better clarity on COVID-related issues and could provide us with feedback to understand happenings at community level. I'm trying to change my slide. Can you see the next slide?
No, we've still got what we've delivered so far.
I wonder why my system has frozen.
You might have to stop sharing and then share again to get it going again. Errol?
Oh no.
I was just going to ask if Damilola wants me to share the slide and then she speaks to them, if that's okay.
Let's just see.
What I'm going to do is to give you control to do that, because it's best I present using my slide. So I've given you control, please. If you can move to the next slide. Thank you.
Great.
Okay, so through the work with our stakeholders, we conducted a community survey to understand the drivers of vaccine hesitancy, and this informed our communications and marketing across different social media channels, press releases, and radio adverts. Next slide. Please permit me, next slide, that's the slide before this. Please permit me to share with you a very short video highlighting some of the work we did with our providers. So if you please click play for me. It's a very short video.
Hi, I'm William Chen from Chinese Community Center, Birmingham.
Hi, my name is Surinder Singh. I work with the Nishkam Centre.
Hello, my name's Safina, and I work with BID Services to provide support to the deaf and hard of hearing community.
Hi, my name is Reese from RMC. We've been working with the Roma Traveller community, one of the most isolated and vulnerable migrant groups.
I work for Disability Resource Centre. And I'm Sharon, I also work for the Disability Resource Centre.
The best part of our work are testing and vaccination units brought to the Chinese community and online forums with Dr. Jastovania, bringing facts, dispelling myths to keep our community safe.
Creating online content for the Sikh and Punjabi speaking community to keep them safe, keep them informed and engaged during the pandemic.
One of the ways we have made a positive impact was to set up a workshop where people could learn how to take a lateral flow test. This was so useful and valuable to the deaf community, so they had a better understanding of the process, what to do if they had symptoms, and to self-isolate if they had a positive result to ensure the safety of others.
We delivered hundreds of one-to-one phone consultations, aiding the delivery of public health messages, and registered many to the NHS app.
We've also posted a lot of information on our website with regards to COVID information and the vaccine rollout and programme.
During that time, we've managed to build trust and confidence amongst our citizens, even those who were most reluctant and hesitant to take up the vaccine.
We've also done some face-to-face work in helping people to complete surveys with regard to their thoughts and views on the vaccine.
We are proud to have helped support creating
a bolder,
healthier
Birmingham.
Yes, thank you. I hope the audio worked very well. If you move to the next slide, please. So clearly from the video, you'd see the one before, please. Yes, next slide. Next slide. So clearly from the video, you can see that a lot of work has been done on COVID-19, but there's still so much more we can do. Now, this slide here shows, I mean, if you look at the cases, and like Toyin Amuson rightly presented, that cases seem to be on a downward trend. But we must know that this might not be a true reflection of what is happening in the community, because as you can understand that free testing has now ended. So it could mean that people are not just testing and reporting like before. Next slide, please. A few months ago, the government set out the Living with COVID strategy for public health to respond to COVID like other respiratory illnesses and to minimize mortality from COVID-19. To implement this Living with COVID strategy, we have structured our objectives around 3 principles: promoting vaccination, addressing modifiable risk factors, and lastly, health protection, especially as we prepare for the Commonwealth Games. Next slide, please. In terms of risk reduction, the science and evidence is clear that people with underlying health conditions with certain risk factors are more likely to die or have worse outcomes of COVID-19. And so if we're indeed serious about reducing mortality as stated in the Living with COVID strategy, we must intensify efforts to address those risk factors. And what are these risk factors? We know them already: smoking, sedentary lifestyle, diet, excessive alcohol, just to mention a few. These risk factors, with the current low vaccine uptake in coverage in Birmingham, will only further worsen the existing health inequalities. Next slide, please. So taking a closer look at one of those risk factors like smoking, this slide shows you the wards in Birmingham with the highest prevalence of smoking. Sadly, smoking accounts for half of all deaths recorded in Birmingham every year. This is quite unfortunate that many people are dying from preventable causes. It's important to state here that smoking, including shisha, damages the lungs and airways, increases the risk of heart disease, damages the immune system, thereby reducing the ability of a smoker to fight infections. So with COVID-19 still circulating, this means smokers are more at risk of contracting respiratory infections, passing it on to their families and communities, and this can also be said of passive smokers. A review by World Health Organization revealed that smokers who get COVID-19 are 2 times more likely to report to hospital with severe illnesses and are at risk of dying from complications of COVID-19. Next slide, please. So what is comms and engagement doing to address this? And this is the point where I share with you our forward plan. From experience and research, we have appreciated that low risk perception and poor health literacy around health issues contribute to poor statistics. And so our team have developed a social marketing plan to address smoking. We are planning an engagement awareness campaign to highlight the free smoking cessation services available in Birmingham and to increase access to smoking services for key priority groups. We plan to target routine and manual workers, young persons, pregnant smokers, and people living in areas of high deprivation. Beyond provider commissioning, we will be collaborating with NHS partners, local service providers, and community groups to deliver these events. Next slide. Our second objective in the forward plan is vaccination. It continues to be top priority for us. We have launched the VAC Immune Project, which aims to work with communities to raise awareness and improve uptake of vaccines, not just COVID vaccine, but all vaccines across the life course. This project is data-driven. We have identified specific wards with low vaccine uptake, and we aim to increase vaccine confidence and uptake of routine vaccinations such as HPV, measles, hepatitis, and the rest. Next slide, please. Our second approach to improving vaccine uptake is the establishment of a diverse group of vaccine champions. About 20 to 25 of them will be specifically trained to engage effectively with their peers in various communities, disseminating information and answering questions around the mechanism of action of vaccines, their side effects, effectiveness, safety. We will train them on how to have difficult conversations on all the life course vaccines. Next slide, please. Next slide, please. Still on our forward plan, we are expanding our youth program to involve older adults between the ages of 18 to 35 years, using a peer-to-peer model to improve information around sexual health, mental health, COVID-19, and other health and well-being issues of young persons. They will be trained and provided with the right resources to effect change in their communities. So basically, what we are trying to achieve is that we want to get Birmingham City talking about a range of health issues. So we have a group talking about vaccine effectiveness, another group talking about wider health issues relating to COVID-19. We'll be working closely with students in universities, colleges, social clubs, supporting them to plan their own events, health events, and street campaigns. Next slide, please. And this is my final slide. In preparation for the Commonwealth Games, Comms and Engagement is working closely with wider public health to support health campaigns linked with the Games and developing holistic messages to ensure visitors and residents enjoy the Games in a safe manner. Our focus in Comms and Engagement is to inspire residents to adopt healthier lifestyles and engage in behaviors that will reduce the risk of spread of COVID-19 and other infectious diseases before, during, and after the Games. By September, the Test and Trace Comms and Engagement will have transitioned fully to the business as usual public health to ensure continuity of all these programs I've discussed with you today. We have begun the transition of our current faith leaders and champions to LD Brom champions. I think just to conclude, I'd like to quickly say that as the narrative around COVID is gradually changing, Comms and Engagement team, we have begun the development of an engagement toolkit to guide our response to future pandemics. We hope there would be another pandemic, but should that occur, we have, we've learned so much from COVID, and we have begun to put, to writing all that we've learned, all that we've done, and evidence-based strategies for future engagement. Thank you very much for listening.
Thank you very much, Damilola. Interesting to see all of that local effort that's been put in there to better explain to people the need, particularly to get vaccinated, and all of that additional data around the risk that people run if they're not vaccinated and if they engage in other unhealthy activity. I do have a one electronic hand, and that's from Stephen Raybold.
Thank you very much for the presentation. It was really useful, and there was lots of positive stuff in there as well. Lots of it was focused on vaccination and healthy lifestyles. But one of the things that we're certainly noticing with voluntary sector organisations and to a certain extent private businesses as well is that there's very variable adaptation to social distancing measures, COVID restrictions. One of the things that's clear is that businesses are not clear about where they're supposed to be in relation to those things. And I wonder whether there could be some focus on either pushing people to open up a bit more and a bit more quickly so it doesn't function as a drag, or around getting people better compliant with the public health messages. It just seems to be that space has gone quiet a little bit, and there isn't as much of a steer as there was.
Yes, thank you. Okay, please go ahead.
Yeah, go ahead.
Yeah, thank you very much for that. When I started the presentation, I did mention that we're still continuing to promote those messages. So yes, we, on our media channels and the meetings we are having with our stakeholders, we are emphasizing the need for them to adhere to those measures, especially those 5 key messages, safe, using face masks when they go to crowded areas, hand washing, how they, respiratory hygiene, which is also very important when they cough out, how to ensure that this is disposed well, ensuring ventilation. All that is part of the work we're still doing. We haven't stopped. Thank you.
Yes, Stephen?
Could I ask as a follow-up question, is the general message then that organisations, unless they're in a high-risk setting, shouldn't necessarily be functioning in advance of those recommendations?
I'm sorry, I don't understand that question.
Well, some certainly, there are some voluntary sector organisations which don't let people in the same room. They're still following very, very strict
Guidelines.
guidelines, which I don't think there's a legal requirement for, but there's still a caution there. And
Yeah.
it's just about us getting clear with them about they can do that if that's what they want to do, but there isn't a requirement anymore.
Yes. So even if there's no legal requirement, this is what we tell people. COVID-19 is a, respiratory infection. So imagine that you're in a room that is poorly ventilated, and then you sneeze into the, in the room, and someone else comes in. They're going to inhale the aerosols. So yes, there's no legal requirement, but we tell people they need to know how this infection, how people get the infection, and then they make an informed decision based on that.
Thank you, Damilola. We will note your report. There are no further indications of anybody wishing to ask a question, so thank you very much. Item 9 is public questions submitted in advance, and I don't believe there have been any questions from members of the public this month. So item 10 then is test and trace budget overview. Ihede, are you presenting this? We can see that.
Yeah, thank you, Leader. If I may, I'll just quickly take you through the budget update, which is building on what we submitted the last time. And the figures are there, so I won't go through all the figures, but essentially over the last 2 financial years, that's 2021, 2022, and then 2022-23, which is where we are. They contain outbreak management funds. The budget was about 27.02 million, with about 19.18 spent in the last financial year, and we are projecting to spend about 9.323 in this financial year. And that's the money that the Public Health Department receives from the national government to support COVID response. The key things, so like the staffing will continue to maintain a high level of test and trace team in Birmingham, both as a contingency towards preparation for the Commonwealth Games, but also to maintain the capacity we have resulting from good, effective management of the budget we had. So we have a strong and big test and trace team. Also, we are beginning to commit more funding towards health and well-being support, which will support other activities which enable the citizens to live with COVID. So there is a slight change in that. And another big point to mention is we also spent about 10 million to support the council with respect to other expenses that were executed by other departments, such as the adult and social care, education, operations, and other units. So essentially, the bulk of the funding came from the CONF money, which is the Container Outbreak Management Fund. There was some other expenses that were supported both in terms of Operation Eagle, which was focused on surge testing, also the Community Vaccines Champions, where we got some funding from the Department for Leveling Up Housing and Communities, which targeted both the community champions as well as the Community Vaccines Champions. Also, the other point to note is that as we are evolving with the Living with COVID strategy, the budget is changing. So for the point when we had asymptomatic testing, we are beginning to reduce that and move the budget to other places. So there will be other changes with the budget, and I will be presenting that hopefully at the next meeting, which will detail the specifics of the budget in line with the Living with COVID plan for the locality. I think in essence, that's the key points about the budget. We are on track. We've managed the budget well, and we've got funds to be able to cope with any contingencies over this period and further down the financial year. Thank you. I will take any specific questions on the budget, but in essence, that's the summary.
Thank you, Ihede. Anybody, any questions on the numbers that we've been presented with? Not seeing any hands, Mahidi, so we will note your update on the budget, which takes us then to any other business. And there's one item that has been notified, and that's a verbal update on the public health preparations for the Commonwealth Games. That's to be given by Mary.
Good afternoon, Leader. And yes, it's good to be back here again. I am sharing a slide. Please confirm when you can see it.
Yes, we can.
Excellent. So my role includes health protection, but other aspects of public health, and it's a focus on the games time experience. So we do separate work on legacy. This is not about the legacy. This is about the games time experience. And I thought I'd just give you a quick update. So in terms of the people that I'm thinking about as we go through this, we've got several constituencies. We've got our athletes who are coming into the city and the officials coming in with them. We have also got the visitors who are coming to Birmingham either to experience some of the Games events or to experience the cultural events that will be happening around. And the third major constituency that I never lose sight of is our host community, our residents who live here in the city. And so a lot of the preparation has been with those three groups in mind. We work closely with the organising committee and UKHSA. Obviously, the organising committee is primarily concerned with the arrangements for athletes, officials, and what I call the workforce, whether they're the volunteer workforce or the paid workforce. And that's quite appropriate for the organising committee. In addition to that, with UKHSA, we are concerned about what happens with the wider games time experience. So particularly all the cultural events that will be happening, the people who are visiting the city who don't go to a single sports event, but nevertheless are coming here because of the Commonwealth Games. So I'm really, really mindful that it doesn't just take place in Birmingham, but that there is a risk of reputational damage if things go wrong or pear-shaped outside of the city, because it is seen as the Birmingham Games. So what we've done in terms of public health and our readiness is we have made arrangements, obviously, for public health cover, specialist cover, for a 22-day period, just over 3 weeks. There will be 24-hour cover. UKHSA have not finalised the hours that they will be working, but it's going to be greater than their normal standard hours at the moment. So we've done our rota. We have a leave embargo, and we will be available should anything happen. We've done our training, so people are ready, have had all their revisions and refresher courses. We've done commander training, stat training, all the things that are required in emergency planning and resilience. So we're ready for that. We have also, as I mentioned a little bit earlier, recognised that the COVID response allowed us to develop an application that collects data, but it also allowed us to interrogate that data, make sense of what we're seeing, and sometimes discover things that would otherwise have been identified later, allowing us to get involved earlier. So we're looking at how we can extrapolate that application to non-COVID situations. That work is well underway and has proved useful already. And we'd be looking again to see how we can use that through the Commonwealth Games as we go into it and come out the other side. So for me, the focus of the Games is not just the 10 or 11 days. It's recognising that our athletes and visitors are coming in some instances, a good 2 weeks before. And because of the various restrictions on the various parts of the world that they're going back to, they will still be in Birmingham, or to some extent, our guests, our responsibility for a period of time after the Games. So that's why we're looking on both sides of it. There's been a huge amount of work going on with environmental health and food safety. We did get a grant with regards to food, which is being used. So I know that my colleague Mark Croxford and his team have been working, bringing forward food inspections, working with businesses, because some of the really big risks in terms of the Games is where people eat, what they eat, There's scope for opportunism, there's scope for good business, and we want to get the balance right. Again, very mindful of reputational damage, reputational risk. Final planning arrangements between the OC and central government are, I'm told, April. I keep saying to them it's nearly the end of April, but we are told to expect the final arrangements. The final arrangements, given that we know that we're still in a pandemic, but we have to say, well, this is how we're going to operate. And then if we get a surprise variant or other situation, we deal with that. But in planning for health protection, we are planning for much more than COVID. If we'd had no pandemic, this would still have been a full-time job preparing for the health protection arrangements. And the most likely things to surprise us are not COVID at the moment. We've had feedback and learning from the games in Tokyo, the games in Beijing, from events, global events such as COP, and the things that have come to bite people in the bum are the things that happen year in, year out. And so we've made sure that we've done the training for that. So as I've touched on DCMS and finalising policies, with their focus is athlete and visitor safety. I say it at every meeting with them. I've also got to be mindful of my residents' safety. I've got to be able to convey to residents that we've taken all the appropriate measurements, not just so that the athletes and visitors are safe, but that so also residents are safe. And as we've touched on the key risks that we've identified and prepared for. So the things that are happening just at the moment, we're finalising a draft MOU with UKHSA. You would have heard in the news recently that there is a retrenchment in terms of their workforce in relation to COVID. So they're working through what that means. We're in a good position in Birmingham because we had judiciously decided to hang on to our additional capacity until the other side of the games. That puts us in a really good place, not just for specialists, but also for practitioners and other public health workforce. So we're confident that we have adequate resource, appropriately trained, ready going into the games. We're working with other local authorities to mitigate and to see how we can optimise that surge capacity because, again, of that risk of reputational damage. In terms of specific exercises, we've had quite a few. We've got another one coming up in a few weeks' time, which is Exercise Taurus, and then there will be a separate exercise with a very specific focus on testing things within the local authority rather than multi-agency. Again, that's all part of health protection and games time preparedness. I've talked already about the division and the leave embargo. So we're making sure that our workforce get adequate rest. And it sounds trivial, but people need to have a break. It's been a long 2 years. So we're encouraging people to, take some leave, take a break before the middle of July, so that we're available and ready to do what needs to be doing over the sort of 3-week period within which the games will fall. Happy to take any questions.
Thank you very much, Mary. It's good to hear that there is that focus on the residential population of Birmingham and indeed the greater Birmingham region through this period. And I think it's also fair to say that elsewhere in the world, countries have not relaxed their regulations or guidance around the COVID pandemic in the same way as the UK has. And so there has been some nervousness from visiting teams for the games about the arrangements that will be in place here in Birmingham for those 11 days. And it's good that we've managed to give that reassurance to all of the visiting teams. Anybody, any questions? No, everybody seems very, very clear on that, Mary. Thank you very much. Does anybody have any other item of urgent business they wish to raise? No? In which case, the date and time of the next meeting will be at 2 p.m. on Wednesday, the 29th of June, and that will again be an online meeting. But as I said earlier, should anything happen, such as a variant emerging that is more lethal than the one we're currently dealing with, then we would immediately convene one of these meetings to discuss the situation. We have no need for any items on the private agenda of today's meeting, so that brings today's meeting to a conclusion. Thank you all very much for your attendance, and keep safe.
Thank you.